Now we have Jennifer O'Connor. Jennifer O'Connor is a senior scientist in the water unit at the Victorian Department of Health and Human Services. She is a qualified microbiologist with over 13 years' experience in a diverse range of roles in academic research, compliance, and policy settings. She aims to improve public health outcome through research, education, advocacy, and policy advice.
Thank you for inviting me to speak to you today, and I'm going to be telling you about maintaining safe water quality in our pools. Here's an overview of the information that I'd like to share with you today. First, I'll discuss why we have public health regulations for public aquatic facilities. I'll tell you about the regulatory roles, responsibilities and compliance requirements. I'll touch on the Water Quality Risk Management Plan, which is mandatory for all Category 1 and Category 2 aquatic facilities. I will discuss what may occur during a council inspection of an aquatic facility and discuss the procedure that aquatic facility operators must follow in the event of microbiological non-compliance. And then I'll discuss some key take-home messages. First, why regulate public aquatic facilities? Aquatic facilities are an integral part of our communities. They are accessible to people of all ages and physical ability, and they're important for our health and well-being and the social aspects of our lives. In 2017, a report on the economic benefits of aquatic facilities found that each visit to a facility resulted in an economic benefit of $26.39 on average, and this was in addition to the leisure value gained by users. But there are some health risks in aquatic facilities that need to be carefully managed. One major public health risk comes from poo in the pool. People have around 0.14 grams of poo on their bodies at any given time. Poo can contain harmful microorganisms. One of these is Cryptosporidium, which is shown in the image on the right in this picture. It's a hardy parasite that's resistant to chlorine and can cause gastrointestinal illness. The graph on the left shows data collected by the Department of Health and Human Services. It's the number of cryptosporidiosis outbreaks per year and by setting. And you can see from this graph that the vast majority of the outbreaks are linked to aquatic facilities. The people most susceptible to serious illness if they contract diseases such as cryptosporidiosis from aquatic facilities include the elderly, young children and pregnant women who may be more susceptible to dehydration resulting from diarrhea, and immunocompromised people who may be at risk of serious or life-threatening illness if they contract an infection from the pool. The health costs of a single episode of gastroenteritis can be serious. For mild gastro, this may cost around $65. A moderate case with a few doctor's visits and some pharmaceuticals can cost around $4,347, and a severe gastroenteritis episode involving hospitalisation may cost in excess of $14,500, and this is in addition to the impacts on the health of the individual and on the social and economic parts of their lives. In addition to the existing known health risks associated with pools, we also have some new challenges. One of them is novel coronavirus. Fortunately, maintaining pool water quality to the regulatory standards is sufficient to manage the risk of novel coronavirus disease transmission in pool water. There will also be some facilities that have closed down and need to start up again, some of which would never have been designed to close. This involves some new challenges in achieving and maintaining good water quality. In these cases, it's very important to ensure that all equipment is working, any stagnant water has been flushed from the pipes, and any biofilms removed. It's also important to ensure that water quality is being maintained within the regulatory standards prior to reopening. There will also be other considerations for reopening, such as having a COVID-safe plan, including regular cleaning of surfaces, meeting the density requirements, physical distancing, and the wearing of masks when not in the pool. Aquatic facilities must comply with all of the COVID restrictions that are applicable to their geographic location and their setting. And facility owners and operators should regularly check government websites for updates. So in summary, there's never been a better time for aquatic facilities to achieve best practice in water quality risk management. As facilities reopen, there's also an opportunity to promote swimmer behaviour change around healthy swimming and pre-swim showers. These activities reduce the number of harmful microbes going into the pool and therefore reduce the public health risks associated with public aquatic facilities. If showers and change rooms are closed, swimmers can be encouraged to have a pre-swim shower at home. The resources that I show you here encourage the use of soap for hand washing, pre-swim showers, changing nappies in nappy change areas only, use of swim nappies for very young children, and not swimming if people have diarrhea. The sticker in the middle is intended to be used with children's learn to swim classes. And all of these resources are available free from our website. You can download them in electronic format, and some of the posters can be ordered in print for free. So we all have a role to play in ensuring safe water quality, from the regulators to the facility owners and operators and the people who use the pool. Now I'm going to tell you about the regulatory roles and responsibilities of duty holders relating to aquatic facilities. This image shows the governance framework for the regulation of aquatic facilities in Victoria. The Department of Health and Human Services, or DHHS, provides the legislative framework, including the Public Health and Wellbeing Act 2008, or the Act, the Public Health and Wellbeing Regulations 2019, or the Regulations. And we also provide the policy framework and guidance to facilitate compliance and monitor and investigate outbreaks of illness in connection with aquatic facilities. Local Council is the aquatic facility regulator. They will facilitate and monitor and enforce compliance with the Act and the regulations and facilitate the registration of Category 1 aquatic facilities by the 14th of December this year. They also inspect aquatic facilities during routine compliance checks or to investigate complaints and outbreaks of illness. Aquatic facilities are the service providers. They are responsible for client and staff health, wellbeing and education, and are also responsible for compliance with the regulations in the Act, Australian standards and industry best practice. The objectives of aquatic facility regulation under the Act and the regulations are to ensure that water quality in public aquatic facilities protects public health, to provide accountability for maintaining good water quality and protecting public health, and they take a risk-based approach to regulation. This means that there's more oversight and monitoring of higher public health risk settings, and in this case, public health risk is determined by the number of people from different households visiting the pool, the number of people visiting the pool who may be in categories that are more susceptible to infectious disease, such as young children, older people and pregnant women, and the number of people who may be immune compromised who are visiting the pool, who have a higher risk of serious illness if they contract an infectious disease. These are the definitions of Category 1 and Category 2 aquatic facilities under the Public Health and Wellbeing Regulations. A Category 1 aquatic facility means a swimming pool, spa pool or interactive water feature that is used by members of the public, whether free of charge or on payment of a fee, is used in association with a class or program that is offered free of charge or on payment of a fee, or is located on the premises of an early childhood service, school or educational institution, or is located on a premises at which aged care services are provided, or is located at a premises that fits the definition of a public or private hospital or similar setting. A Category 2 aquatic facility means a swimming pool, spa or spa pool that is used by members of the public and is located at the premises of either a residential apartment complex, a hotel, motel or hostel. And although not defined in regulations, members of the public in relation to Category 2 facilities is interpreted to mean a non-resident or a non-owner, in other words, guests and visitors. This slide shows you a summary of the key compliance requirements that apply to Category 1 and Category 2 aquatic facilities under the regulations. Category 1 aquatic facilities must register with Council by the 14th of December 2020. Category 2 facilities do not need to register. All of the other compliance requirements apply equally to Category 1 and Category 2 facilities. One key requirement is under Regulation 46, the requirement to manage risks to human health arising from pathogenic microorganisms in the water in the aquatic facility in accordance with the regulations and the water quality guidelines for public aquatic facilities managing public health risks, called the guidelines. This document, the guidelines, is also available on our website. Aquatic facilities must ensure adequate training and competency of aquatic facility operators. They must have a water quality risk management plan and undertake at least one daily check of key pool water quality parameters before the pool opens for the day, and operational monitoring every 4 hours while the pool is open. And at least one of these daily checks should be done by hand and analysed manually. It's strongly recommended that this check that's done by hand is done before the pool opens for the day. And the key parameters are free and total chlorine and pH, or free and total bromine and pH. In the event of non-compliance with microbiological parameters, aquatic facility operators must follow the prescribed procedure for responding, which is described in Regulation 59. Aquatic facility operators must keep written records for 12 months from the date the record was made. And at the discretion of local council, facilities may be subject to an inspection for compliance with the regulations and the guidelines. And all of this information is available in a fact sheet that's located on our website. So who is responsible for compliance? Well, that's the registration holder and the aquatic facility operator. The registration holder is the applicant for the certificate of registration and would usually be the proprietor or the owner of the premises. The registration holder has the ultimate responsibility for ensuring that the standards and requirements for a Category 1 aquatic facility are complied with. The aquatic facility operator also has a duty to ensure that the standards and requirements are met. The aquatic facility operator is defined in Regulation 4 as a person who owns, manages or controls an aquatic facility. For Category 1 aquatic facilities, the aquatic facility operator may be the proprietor, or it may be a person or company the proprietor contracts with or engages to manage their facility. For the case of Category 2 aquatic facilities, they are not required to register with council. Therefore, the aquatic facility operator has the ultimate responsibility for ensuring that the standards and requirements are complied with. To assist aquatic facility operators and owners to comply with the regulations, we have a range of supporting resources on our website. The first is the Water Quality Guidelines for Public Aquatic Facilities Managing Public Health Risks. This is currently under review. Compliance with this document is mandatory and it can be downloaded from our website. We also have a Water Quality Risk Management Plan template and a guide to support the development of a Water Quality Risk Management Plan. These are also available on our website. We have the free healthy swimming resources that can be ordered online. And we also have a range of incident response procedures that can be adapted to your own facility. Now I'm going to tell you about the Water Quality Risk Management Plan. A Water Quality Risk Management Plan details how aquatic facilities will comply with the aquatic facilities provisions of the Act, the regulations and the guidelines. The guidelines state that a water quality risk management plan must include the following elements: staff roles, responsibilities, competencies and training requirements, a description of the facility, its source water and its treatment systems, water quality targets and treatment objectives, hazard identification, risk assessment and control measures, operational and verification and monitoring, incident management and response procedures, and data recording and reporting. The department has developed a template that aquatic facility operators can use to prepare their water quality risk management plan, and this is available on our website. Use of the department's template is not mandatory. Aquatic facilities can use their own water quality risk management plan template if they wish, provided that it addresses all of the mandatory elements. Now I'm going to tell you about aquatic facilities inspections and the procedure for responding to microbiological non-compliance. Aquatic facility inspections would usually be carried out by an environmental health officer from the local council. These may be done as part of a routine compliance check or in response to a complaint or a report of an outbreak of illness. What might an aquatic facility inspection include? For Category 1 facilities, the certificate of registration might be checked to ensure that the registration details are current. The water quality risk management plan and policies and procedures may be reviewed. Chemical and microbiological water quality may be tested, and the facility may be inspected to ensure cleanliness and appropriate management of chemicals and equipment. Other matters that may be considered include a review of records and operator training records and incident response procedures. There is an existing Environmental Health Officer inspection checklist in Appendix 8 of the Water Quality Guidelines on our website, and we're currently developing an updated checklist which is intended to exist as a standalone document in future. We're also working with Lifesaving Victoria to develop an Environmental Health Officer training course. So now I'm going to tell you about what aquatic facility operators need to do if they receive a report of microbiological non-compliance. Aquatic facilities must comply with the regulated microbiological parameters. These are listed in Regulation 49. For water sampled from each aquatic facility pool, spa or interactive water feature, the heterotrophic colony count must be less than 100 colony forming units per mil, and E. coli and Pseudomonas aeruginosa must not be detected in 100 mils of water. These water samples should be sent to a NATA accredited lab for analysis. For higher risk facilities such as Category 1 facilities, it is recommended this test be done at least monthly. If the aquatic facility operator receives a lab report of non-compliance with the microbiological parameters listed in Regulation 49, the procedure outlined in Regulation 59 must be followed. So within 24 hours of receiving a notification, the aquatic facility operator must ensure that the following procedure is implemented. Corrective action is taken to bring the water quality within the microbiological parameters set out in Regulation 49. Any water quality risk management plan required under the guidelines that is in place for the facility is reviewed, any faults are corrected, and any changes necessary to prevent a recurrence of those faults is implemented. And then within 48 hours of receiving that lab notification of non-compliance, the operator must ensure that a second sample of water is taken from the facility and provided to a laboratory to assess compliance. Once both of those results have been received, council needs to be notified of the results within 24 hours. If the second sample of water returns a non-compliant result, the procedure needs to be repeated. And if 3 consecutive non-compliance results are received, the facility must close and notify council in writing. A copy of this procedure is available to download from our website. So to summarise, the key messages for my presentation today are that maintaining good water quality protects public health. Everyone has a role to play in maintaining good water quality in the pool. Category 1 aquatic facilities must register with council by 14 December this year. All other compliance requirements apply to both Category 1 and Category 2 facilities. All facilities must have a water quality risk management plan, and your local council will determine the inspection timing and frequency for your facility. In the event of non-compliance with microbiological parameters, facility operators must follow a defined procedure prescribed in Regulation 59. And supporting resources are available on the department's website. So let's work together to keep swimmers healthy in pool water. For further information, please contact us at the Water Unit, and if you require information on COVID compliance, please check the Victorian Government's websites for current restriction levels and information on industry restart guidelines. And thank you for your attention.